the Fence. I'm Jolie Whitney. April 7th through 13 is designated as National Public Health Week. Since the founding of the American Public Health Association in 1872, the lifespan for Americans has increased an average of 35 years. While there are several factors that contribute to this increase, public health is one of the top determining factors. From vaccination programs and disease eradication to seatbelts and increased helmet use, public health is public good. And to talk about public health, I'm joined by Tom Griffin, an assistant professor of medicine in the Division of Public Health at UVM's Larner College of Medicine. He's also a civil affairs officer in the Army Reserve who has served overseas in Afghanistan. Welcome.
Thank you. Thank you for having me.
We're happy to have you, and before we get too far into it, let's start with some brass tacks. So how do you define public health and kind of explain its role in the U.S.?
Yeah, sure. So with public health, I really think of two P's that I want to drive home, and that is population and prevention. So with population, that's the who of public health, and that can range from neighborhoods or other communities. Vermont is a very town-centric state, so a lot happens at the town level and other municipalities. And so we want to think about the health of populations, so beyond just the health of individuals. And with prevention, we are looking at promoting healthy lifestyles and healthy behaviors to kind of cut things off in bad health scenarios and cut them off further upstream. So yeah, those are the two things. There will be some more P words later on.
Right, we'll get into those a little bit more. And public health has played an important role in stuff like awareness campaigns, which I'm sure has something to do with the prevention side of things. And that can talk about anything from seatbelt safety or immunization. So why are campaigns like this so important?
I think they're really important because they help to translate science, which can be techy and complicated, and turn it into everyday language and everyday behaviors that make sense to populations, like I had just mentioned. And I think we are in an environment of many suffer from information overload. I certainly do. And so I think of myself in teaching as a curator of good quality, rich information for students. That's what campaigns does for the public with science-based information. And so as an example, I'm here today because of a campaign. And so the American Public Health Association, as you mentioned earlier, is supporting National Public Health Week. And within this week, there are there's many activities and speakers and things to do, but there are themes that come with that we want to translate these terms into digestible bits. One of them is resilience, and that comes often in the context of the climate. Another one, for example, is optimizing health for everyone. And as a geographer by trade, I think about how much of your health is dependent on your zip code and where you live. And then another one is advocacy, which we'll talk about a little bit more later on. But those are the key themes that are just simple, bite-sized. And another example is, shout out to your YouTube, by the way, because as I was
Thank you.
Planning for this, I saw yesterday's episode about the arthritis awareness campaign. And so I think it was Suzanne Kelly from the health department and Dr. Karen Westervelt from UVM were talking about things that can be done to delay the onset of arthritis. And that is public health campaign in action. So great. I don't know if that was planned to roll out that way, but that was excellent to show a real world example of what a campaign looks like.
Absolutely. And other than, of course, being featured here in Across the Fence, which we're happy to have you, do these campaigns look like ads on social media or on TV or billboards, or can it be a huge range of things?
Yeah, it can be a huge range of things because you have to meet audiences and populations where they are. So I think of maybe younger audiences who you might have to go out to TikTok and other forms of social media. Even things that were for us millennials, like Facebook and Instagram, are not necessarily what is the mechanism or avenue to communicate with those that are younger or those that are older. And so I think of the Jericho market where I go a lot, and there are posters on the tacked up on the board, and there can be campaigns by way of print ads and print information and brochures still go a long ways. And then you can't discount other community venues like libraries, for example, or health clinics where there's information that's accessible.
Absolutely. And when does public awareness turn into public policy? What's that process like?
Yeah, so that's where there's two more P's. So I think if there's anyone savvy here in alliteration, you could have a great field day with a campaign, but I think when I think of policy, I think of protection, which is another part of public health. And policy is designed to protect, and that's why we have laws and regulations. And a good example of that is clean indoor air laws. And so if you look about how that rolled out in the last couple of decades, it started with science. And science is what showed that exposure to secondhand smoke leads to cancer and heart disease. Well, as campaigns made that easily to understand, then the public started to take notice, and everyone was like, hey, I don't want to be exposed to this and be subjected to heart disease or cancer later on down the road. And you started to see a slow kind of mobilization happen, and when there is enough of that, then there is more political will to enact policies and connect with legislators who can set laws. And yeah, so it started again with the science, got to the community action and mobilization of public support, and then the regulations.
Yeah, that makes a lot of sense. And we're now 5 years removed from the start of the pandemic. So how does public health stand now?
Yeah, good question. We were just reflecting on the COVID years earlier, and public health is more visible, I think, than it ever has been. And that's a good thing in the sense of, now everybody knows what an epidemiologist is. The flip side to that is now maybe everybody thinks they're an epidemiologist. And so there's that fine line between wanting to have accessible information and be literate in the information you're receiving, but also not knowing maybe or having enough to be dangerous. And we'll talk about misinformation and quality information here shortly. But so with that, I think public health had many displays of strength during the pandemic. We showed that we were adaptable and innovative. I think about contact tracing and how quickly that went into place. I was at a conference last week and talking to somebody who was part of the big data folks behind the CDC, and they shared a great story about how they were scrubbing social media of schools across the country, because that was how schools were communicating their closures during COVID. And so looking at social media, that became the best source of information to create these dashboards for school closures nationally, so everybody could see sort of where they stand and which communities were the most at risk or the most affected. And that's a great example of adaptability. One of the downsides to the COVID years, especially with public health, is things like routine screenings and cancer screenings were delayed. Mental health certainly surged. And so when I reflect on that and think about where public health is at today, I think about how there is sort of a need to build on those strengths, but also repair trust in some regard. I think we need to be showing that we're back on track with routine screenings and other aspects of public health, and communications have improved quite a bit. I mean, look at this opportunity, for example, and I think there's a lot of better preparedness for the next pandemic, for if it ever comes.
Sure, hopefully not.
Yeah, exactly, knock on wood. I'm very superstitious.
And we talked about kind of on the national level a little bit, but what does public health look like specifically here in Vermont?
Yeah, in Vermont, I think I'll always start with the population. So what are the characteristics that I think of with Vermont? I think of Vermont as being a very rural state. And with that, let's talk about a rural challenge that you might not think of for health, and that's transportation. I mean, we're right in the thick of mud season as we speak, and so think about those who might not have easy access to transportation to their health appointments. I was just looking at the other day at the Green Mountain Transportation Association. That's a great resource. Green Mountain Transit is an excellent resource to get people access to health when they're facing this rural specific challenge. Another one on the rural front is that I've recently joined an amazing team from the Maine Rural Health Research Center, now the Northeast Rural Health Research Center. And so I have these excellent colleagues who invited me in from the University of Southern Maine. They had done some phenomenal work on ambulance deserts and mapping out places where there are ambulance and healthcare infrastructure deserts. The next phase of that is I'm going to help them with mapping out broadband deserts and nursing home deserts. So you can start to see, like, if you picture kind of a map and you see like somebody that is outside of a radius for an ambulance, is outside of a radius for broadband, for telehealth, might be older and is outside of a radius for nursing home. I mean, those are the most vulnerable populations, which leads me to aging is, I think, the second characteristic that I think of with Vermont's population. And with aging, I think of the importance of promoting healthy lifestyles, staying active, good nutrition is important, and then back to prevention, fall prevention is something. And so what I love about Vermont is we do have access to resources, and I think of, for example, the United Way of Northwest Vermont has some great programs for the elderly in particular. So those are, again, two populations with very tangible things that we can do.
Absolutely. We only have a few minutes left, but I quickly want to ask, we touched on this a little bit, but can you talk about how disinformation and misinformation kind of create some challenges for somebody working in public health awareness?
Yeah, absolutely. So with misinformation and disinformation, it can spread so quickly online these days. And that, I had written a blog post about the misinformation that came after the most recent bout of floodings, I think in 2023. And I talked about how there was a flood of misinformation. So while I was trying to be clever in the title, it was real, and information was spreading so quickly. And I like to talk about when that happens, there is distrust. So to combat distrust, we have to find credible sources. Well, how do you know if you are on a website and if it's credible? And I think of looking at sites that if you can see if there's evidence base and there's science that is cited, if you go to the About Us page and there are bios and some description about the mission, if they are clear about their funding sources, if there's a last updated kind of ticker at the bottom so you can see that they are constantly updating. Those are just some little clues that you can see to make sure you're checking out a reputable source.
Absolutely. Thank you so much for joining us today. I'm afraid we're out of time, but if you'd like to learn anything else about Vermont Department of Public Health, you can visit the link on the screen here. And if you want to see anything from the Center of Disease Control and Prevention, that link is there as well. And that takes care of our program for today. I want to thank the crew behind the scenes here at WCAX for helping make our program possible. I'm Jolie Whitney. This is Across the Fence. Have a good one.